Hi, I'm Dr. Janet Pope. I'm at Room Now, a reporter, and I'm coming to you live from Philadelphia, ACR 2022. I wanted to talk about non-adherence in lupus. Why is it important? But just as important for us as clinicians, what do we do about it? So I'm going to talk about three abstracts. So the first is from the SLICC, or the SLE Inception Cohort Cooperating Clinics. And they looked at 660 patients with SLE. And they looked at hydroxychloroquine levels. And they said if you were below a certain level when you were on 400 milligrams or a half that level on 200 milligrams a day, you were considered non-adherent. This is abstract number 0343. What they find in a nutshell, if in the first year you have low hydroxychloroquine levels, there's three important things. Number one, increased flares in the next year. Number two, more accrual of damage over the next 5 years. And 5-year mortality was increased. So very solemn. What are we going to do about it? So there's two abstracts that I want to talk about. One was to have looking at non-adherence in minorities such as lupus patients of color. This was abstract number 0115. What did they do and what did they find? They interviewed clinic nurses, rheumatologists that treated lupus patients, and lupus patients themselves who were minorities, patients of color. And they found basically three things. They found that an optimal intervention to improve adherence will need capability, opportunity, and motivation. Well, what's that mean? Capability, you got to have access to your meds. Opportunity, reminders, social media, other ways to help you to take your meds, and motivation through empowerment, and really, again, ways for patients to understand and education to take their meds. The final one I want to talk about is that if you're going to look at adherence in 4 minutes, actually 3.9 minutes, you can discuss adherence. So doctors in a lupus clinic were trained that if a patient was filling their prescriptions for their lupus meds less than 80% of the time over the last 3 months, to have an intervention. So of 24 encounters like this, 21 had positive reinforcement, and the patient said it was validated in 17 of those 21, and 11 had open-ended questions. This is abstract number 0063. Bottom line is non-adherence in lupus can kill our patients. There's ways of improving it by looking in qualitative studies and then enacting it, and this is a way in 4 minutes you can discuss adherence with your patients. What we need to know next is if I discuss non-adherence and help the patient become more adherent, will change outcomes? I hope so. Coming to you now at Room Now. Thank you.